Matovu, and it's the Health Q&A talk show. That's question and answer, where we give you an opportunity to interact with the experts in studio and ask them questions in line with the topic of discussion. And we have a tagline where we say, your health, your say. Now today, hormonal imbalance is a struggle that many women out there are undergoing, and it is quite confusing. It is misunderstood, it is dismissed, or it is wrongly treated. Now, from irregular periods, mood swings, fertility challenges, it carries quite a lot of components with it, and most of them are sometimes not understood. The signs can be very confusing and are often overlooked. Now, I normally tell you that we bring the experts for you, but the critical question remains, are the women getting the right diagnosis or they are not? And we also have a tendency of resorting to herbal concoctions to think that it's a remedy to enable you overcome whatever it is that you're going through. Today, we unpack the realities of hormonal imbalance among women. With me on set here is Dr. Judith Ayikirize, who is a fertility doctor. Good morning.
Good morning, Madam Sophie.
And thank you for accepting to come through.
Thank you too for the invitation.
Okay. Then we also have another expert, and that is Dr. Moses Batwala, who is the medical director and founder, Fiona Fertility. Doctor is coming all the way on Zoom from Dubai. Doctor, good morning. Dr. Moses, are you with us? Okay, he's not yet with us, but he'll be joining into the conversation later. But first, let's start right away with Dr. Judith. Dr. Judith, when you talk about hormones, what are hormones? Because we're saying hormonal imbalance, but they are the hormones. What are hormones?
Hormones. Good morning, viewers. Thank you, Madam Sophie, for this invitation to come and elaborate more about hormonal imbalance. Before we dig deep in the problem, which is hormonal imbalance, hormones in general are substances in our bodies which enable our bodies to function normally. But the commonest hormones that we know of are the female hormones and the male hormones, which help us to continue the process of procreation. And these substances are produced in different parts of our bodies, and they coordinate in a proper way to ensure that they deliver the information they're supposed to deliver, and our bodies are able to respond and work effectively.
Okay. Now, since this is Women's Month, after Women's Day, we're still very proud to enjoy the feeling of Women's Day throughout the whole month. Let's get to the issues. What are those important hormones that are very essential in the women and that support when it comes to issues of fertility?
With women fertility, we have hormones coming right from the brain. We have like 3 stations where the hormones come from. That is 2 stations in the brain, then the other station is right in our abdomen or in our pelvis, the ovaries. So in the brain, we have a master gland called the hypothalamus, which produces hormones called releasing hormones. They help now the second part in the brain called the pituitary gland to produce other hormones which take the signal to the ovaries to bring about the necessary features for someone to become a woman, for someone to properly function as a woman. So in the brain, in the hypothalamus, we have an important hormone called gonadotrophin releasing hormone. Then in the pituitary gland, we have luteinizing hormone and the follicle stimulating hormone. So it is the gonadotrophin releasing hormone that sends a signal to the pituitary gland to produce the 2 hormones I've talked about, the luteinizing hormone and the follicle stimulating hormone. So when the pituitary gland produces the hormones, they send the signal all the way to the ovaries. Then the ovaries produces other hormones which are very important, which most people know about, the estrogen, the progesterone. Yeah, basically it is that proper coordination that brings about everything that works well together for a woman to function normally, be able to menstruate normally, be able to have breasts. So these hormones are produced at different stages in our lives. Like a child, every child is born with ovaries, with a brain, but these hormones may not be so fully functional until someone has reached puberty. That is in females between 9 years and above. Yes, that's why we expect these hormones to start being more active, and that signal that I've talked about starts operating fully at puberty from 9 years and above. When it begins at that point at puberty, it brings about breast development in women, in girls. Then the menstruation begins, whereby someone ovulates, ovulation happens, then bleeding happens. Basically, that's how I can describe the hormones.
That's interesting. Would I be right to say that now we're talking about hormonal imbalance. Okay. Would I be right to ask myself and say, okay, if the hormones become active at a particular stage, during our times, it was were the hormones dormant, because they would start becoming like, people would get into the puberty stage at a particular, in the teen period, but now you have a scenario where you're seeing it more pronounced at early stages, even below the teen period.
Yes, I must say hormones have changed over time. Maybe the response to these hormones has changed over time, partly due to certain factors, which are lifestyle. The foods we eat have changed over time. The kind of activities we do. You realize that with the new era where people are more on their phones, on TV, they are less active. They no longer engage so much in exercise, so they gain maybe a lot of weight. Sometimes girls require a certain weight for the puberty to start, or like the menstruation to start happening. So you realize maybe earlier in the days, the feeding was okay, people eating lean foods, foods that don't contribute to a lot of fat. So that would be a delay in the onset of puberty. But with the introduction of the new foods, the junk foods, more fat foods, our children experience puberty a little bit earlier.
Okay. Yeah. Now, when we talk about the hormonal imbalance, how big is the problem? How does it affect the women?
I must say hormonal imbalance is a big problem, bigger than actually we used to think. Globally, infertility affects 15% of the population. Generally, the couples, 15% of them experience infertility. And both men and women experience hormonal imbalance contributing to infertility. But for men, it is really a less problem compared to the women. But for women, it's really a big problem. A big problem contributing to infertility. If I'm to take you through some factors which affect fertility in women, other factors really which cause infertility in women. We have ovulation factors, which ovulation factors really are mostly dependent on hormones. That's the problem we are describing today. Ovulation factors are equal to hormonal imbalance most times. This problem accounts for 25 to 40 to 50, about 50%, 25 to 40% of the other factors. It's the biggest contributor to infertility in women, followed by the tubal factors, which accounts for 20 to 35%. Then other factors like fibroids, the cervical factors are really, they account for about 10% only. Then other factors are like advancing age. Women take more time advancing career, making ends meet, and they can conceive late. So it also contributes a small percentage to people who are to infertility. Yeah, basically it's the biggest problem. If hormonal imbalance is the biggest contributor of infertility in women.
Okay.
Yes.
Then can you help, because there are certain times women will undergo these body changes but will not seem to realize and even notice. What are some of the symptoms they should look out for and say that, hey, this is a warning sign, I think I need to look up my doctor?
Now, some hormonal imbalance issues may come up right from puberty, when someone gets their periods, when someone is getting the breasts. Sometimes we have what we call primary ovarian insufficiency. Like as a mother, you should be concerned when your girl exceeds 16 years of age without having periods, without having breasts, because between 9 to 16 years, puberty should begin. So that's one sign in a girl child, which would signal to you that we may be having a problem with the hormones. Then, as you grow, maybe if someone has achieved normal puberty, other things that can signal to you, if you're a woman, you expect a monthly cycle, like you should have periods every month. If that is not happening, you're missing a month or two, that should signal to you that you could be having a hormonal imbalance. In a woman, if you have excess hair on your body, women are not supposed to have beards, ideally. Even though a few strands, sometimes you should not take it for granted. It may signal to you, and it may be an early sign of hormonal imbalance. Some people, they may be having periods, but they have those excess hair. But later on, they may develop other symptoms, which also point to hormonal imbalance, like the irregular periods. Then, for some people, if you've gained weight all of a sudden, extreme weight gain can signal to you hormonal imbalance. Here, some of the factors that can cause abrupt weight gain are like there is a gland here in our throat called the thyroid gland. That hormone, when you have less of it, you can tend to gain a lot of weight. Then when you have a lot of it, you can have weight loss. So excess weight gain and excess weight loss in a short time should signal to you that you may have a problem with hormones. Because other than the hormones I've talked about, the gonadotrophin releasing hormone, the luteinizing hormone, the follicle stimulating hormone, the estrogen, progesterone, there are other hormones in our bodies which can cause fertility challenges if they are in excess, like the thyroid, the hormones produced by the thyroid glands. They are called thyroxine hormones. Thyroxine hormone T3, then T4. Yes. So if those ones will really cause weight changes most of the times. Yeah. Then other conditions, like in girls or even in women, excess milk production. Sometimes someone is not breastfeeding at all, but they are having milk coming out of their breasts. That is not normal. It should signal to you that you may be having a hormonal imbalance. That hormone is called prolactin. It should only be produced when someone is breastfeeding. But I've encountered girls 15 years, 16 years who are having that breast milk coming out or just watery discharge. Yes, that one should signal to you that you could be having a hormonal imbalance. Such people may not miss periods, but they may find it hard to conceive. Or sometimes they may miss their periods because that hormone, when it is in excess, it causes milk to come when it is not supposed to come. And also, it doesn't only do that, it suppresses the brain from sending the hormones or the proper signals to the ovaries to produce the female hormones, the estrogen, the progesterone, to function normally.
Wow. Wow, this is just like... Now, because there are certain times when you talk about most of the symptoms, they are painless.
Yes.
Why should somebody struggle to go to the clinic or to the hospital, and I don't know if there's a method in which they are diagnosed. How do they diagnose them? There are certain times maybe a doctor might dismiss it and say, oh, you have beards, oh, that's not a big deal, you know? After all, it's painless. Is it giving you a hard time? No, just keep shaving and move on.
So most of the conditions, that's true, so, Madam Sophie, they are painless and people may not mind so much about them. But as doctors out there, I would recommend we really look out for these women, even though they have the most mild symptoms, we take initiative to screen them for the hormonal imbalances, because not only these conditions affect that time or affect fertility alone, they can cause other health challenges, like polycystic ovarian syndrome. It is diagnosed anyway from how someone appears, that excess hair, then from the history, someone telling you they are not menstruating every month, having the irregular period. Then when you do the scan, we can do a scan now to diagnose polycystic ovaries. You will find many cysts in both ovaries. Then we also check the blood. So we look at the radiological findings or the scan findings, plus the history, plus what we see on the person, maybe excess hair, then plus the blood. We check blood for these hormones. We can really see according to their normal ranges, if they are in the normal range or if they are above or low for what is expected. So most of those hormonal imbalances really can be diagnosed in blood, and then you may need supporting information from the scan and also from talking with someone. Yeah.
So they are specific, is it the gynecologist that people should see in line with that? Does everybody have the right equipment to be able to diagnose? Or there are certain times some people might think, the best way to go about it is putting you on supplements?
I think most doctors out there, if they have the necessary equipment, the necessary lab, they can be able to diagnose most of these conditions. But best done in fertility clinics and gynecological clinics, really, because we concentrate much on those conditions, and really we try as much as possible not to leave out these hormones uninvestigated. The main issue maybe here in Uganda, some people tend to use insurances. Insurances don't usually cover those hormones. So it takes now a patient's initiative also to say, if my insurance is not covering this hormone and I have a problem, I should have it done using my cash, because hormones are not covered even on insurance. It needs cash. But if you go to a right facility, they should be able to do these investigations. Most labs can do them here in Kampala, but deep in our villages, it's hard. They don't have the necessary labs. So the earlier you identify it as a doctor, even in the rural setting, it's better to refer to centers which can be able to do these investigations so that the woman is helped.
Then what about the bit that, like, I'm glad you say that if you're in Kampala, where you find most of the high-tech labs, but up country it's a different story. Some of them have resorted to herbal remedies, and they believe that my herbalist there will kuyenga for me mumbwa, and that will be sorted. What's your take on that?
I think really medical things should be tackled medically. If you have a problem, I understand in Uganda most people seek first opinion from the herbalists, from the even mixing for themselves the herbs, reading up and there. But I would encourage really someone to seek professional advice if they have a chance to get such information, or even people who have had this information should be able to advise well the people maybe who don't have this information. Say that someone is first screened and we know the magnitude of the problem instead of taking the herbs, because these herbs can cause other problems someone didn't have. Yes, so really I would recommend we mind about our bodies, don't self-medicate, and seek the right medical treatment early enough.
Okay, just speak to the person watching you right now, how hormonal imbalance can lead to related complications later in the future if not addressed or attended to.
Thank you very much, the viewers. So hormonal imbalance is a big problem, whether someone is trying to conceive or not. It really affects far beyond fertility issues. Like for example, polycystic ovarian syndrome should be managed well, whether someone is trying to conceive or not, because it can cause other conditions like type 2 diabetes in the end. If not properly managed, it can cause obesity. So it's better really to determine the disease process early and be able to manage it in time. Then other conditions like thyroid disorders, they may be contributing to fertility challenges, but also they can have other negative effects in our bodies. So it's better to always look into them early enough and seek proper medical advice. When we get to the end of life, we have hormonal imbalance, more significant there, the menopause. In menopause, we have a reduction in most of the hormones, the estrogen, the progesterone. These hormones during the reproductive age, they help our bodies to function normally, to regulate the temperature. So such a person, if they don't get in proper hormonal replacement therapy, they may experience extreme hot flashes, sleep disturbance, or related to the hormones. They may get challenges with their cholesterol regulation. When these estrogen, the progesterone hormones are in the body and they are working well, they tend to regulate how fats are used up by the body. But after, like in menopause, their role tends to go down and someone is at risk of abnormal lipid profile. Then our bones are also very much dependent on the estrogen, the progesterone, which are the female hormones. So as someone grows older, they are at risk of weakening of the bones, bone fractures. So hormones are very important, and replacement of people who have extremes of these effects in their extreme of age is very important to really deal with.
Once managed correctly, or once diagnosed, by the way, correctly, how do you manage? Because assuming somebody has come to you, they are having the issues, then you're able to point in the right direction that this is what it is. How do you manage? So,
just like we've talked about the different hormones, the hormonal imbalances come out due to different factors. You will have to deal with the problem depending on, you may need to deal with the problem depending on the cause. If the cause is really manageable, you will manage it according to that particular cause. Like most hormones, which are like for women with polycystic ovarian syndrome who are not menstruating normally, the first line, losing some weight, would really do a big deal in helping them ovulate. So lifestyle modification would really play a role, modifying the diet, taking more fiber in the diet, reducing on the fats, and cutting on the body mass through exercise, through the diet would really help this person. Then hormones would, like for people who have reduced hormones or who are not ovulating, who are not menstruating, hormones would help them to achieve normal menstruation cycles. Then for problems with ovulation, there are medications which help ovulation to occur. Ovulation means as the woman moves through the menstrual cycle, in the middle of their cycle, the egg is released and it goes to the tube to meet with the male sperm. So usually if that egg doesn't come out in some women because of hormonal imbalance, it can be solved by ovulation induction drugs. Then for other conditions, like which are very specific, like where someone is having abnormal milk letdown, there are some hormones that can be given to them to suppress that excess hormone that is being produced. Yes. Then other conditions like the thyroid disorders, whether it's thyroid hormone excess or low levels, we may need some hormone replacement therapy. We may need medications to reduce the hormones. Basically, the treatment is targeted towards the cause.
Okay. When and then at what point do the supplements come into play? Because there are certain times when they'll tell people that possibly these supplements will help or will add on to what you're losing. Yeah. So when do they come into play?
I think supplements really do, they should go hand in hand with real medication, which is treating the problem. But when used alone, may not have significant effect. but they surely contribute. Maybe some supplements which help people to lose weight, they are good, and they would help to solve the problem maybe of ovulation. Supplements which some supplements have hormones which people don't know. So such supplements would also work magically, but it would be at the background of maybe certain hormones. So really, supplements should be used hand in hand with the real medication for treating the condition.
Okay. Now, on a regular, for you as a doctor in that area, how often do you see people with those issues of hormonal imbalance? Let's say out of 5 patients on a daily, how many do you seem to diagnose or realize have that issue?
So take an example of 3 women. On average, every 3 women there is one with an imbalance. So really it's a big problem even worldwide. If you lined up like 30 patients, 30% would have an imbalance. So really it is a big problem, and women face it so much, but for men it may not affect them as much as women. But everyone in their lifetime, they may experience a hormonal imbalance.
Yeah. Okay, like we say, it's your health, your say, and the show is specifically for you to be able to interact with your doctors. At this particular time, I would like us to start going right into your questions, and thank you really for participating. This is a person who is saying, what might cause a woman to get swellings on her eggs? That's what the person asked. And then there's another who says, Doctor, thanks for your program. We learn a lot from it, and may God bless you. This is Taremwa Godfrey. Taremwa Godfrey, Doctor's Clinic, from Doctor's Clinic, that's what he says. Then what are the, somebody was asking about what are the causes, yeah? Okay. What are the causes of hormonal imbalance, and how does this affect our health? What is the big problem with the imbalance if not handled? And what are the symptoms of hormonal imbalance in men? You've talked about the one for women. Now you're cheating. This is women's issue, women's show. But nevertheless, since you've asked and she said it does occur in both sex, men and women, she will respond to, you know, the symptoms for hormonal imbalance in men. In men, how do they identify that they're actually having the problem?
Thank you very much, viewers, and thank you for your questions. For men, some signs of hormonal imbalance, someone may have reduced libido. That is what someone can really identify. Then when you come to us in the clinic, we do for you a sperm analysis to see if your sperm parameters have changed. Most of these men who have hormonal imbalance, we shall find their semen analysis having low levels of sperm compared to what is expected. And also when we do for them blood tests, maybe their hormone levels, there is a hormone which is specifically for men to appear like men and be able to produce the sperms, have the beards, that is a testosterone. It will be low in their blood. So really, it will affect the sexuality, it will affect even the masculinity. You'll find someone has no beards, yet they are men. So even when someone already had beards, they may go off. They may have some hair losses, the hair distribution may change if they, along the way, get anything that compromises their hormones.
Okay. Then this is good morning, moderator. Thank you for today's show. I am Riri from Fort Portal. I've been having painful cramps each month, and it's really bad that I can't sleep on the bed and I hold it tight for hours just so it could calm down. What could I do to reduce this but not interfering with hormones? Then the second question is about the beards. Each time I shave, the hairs increase. What can I do to remove this, or something I could take to balance the hormones because it interferes with a woman's beauty?
That's a woman.
Yes, it's a woman. Each time she shaves, she's having beards. Each time she shaves, they just increase. The volume just becomes more pronounced and more pronounced.
Just like we've said, one of the signs of polycystic ovarian syndrome may be just the beards. So with the beards, we would, with this particular patient, would want to know, are they having any other fertility challenges? Any fertility challenges other than the beards? Yeah, but for the beards, there are medications which can help them reduce the beards. But if they are having other life challenges, they would need to be dealt with. Just like I've told you, it doesn't just occur in isolation, like someone having beards. They have a hormonal imbalance underlying that. The excess beards come, the beards in women come because you have more of the male hormone, which you're not supposed to have. You should have it, but in very little amounts. So when someone has it in much amounts, that happens, the beards. So by doing some bit of hormonal balancing for them, it would help, but also there are creams specifically made for that to reduce the beards.
Okay. Then hello, for me, I'm looking for a child, but I had hormonal imbalance, but I was given microgyno, is it, for 3 months. This person wants to have a child and has used this for 3 months. I do not know whether you continued use after the 3 months what you were told. Maybe, doctor, you can intervene and respond to him.
Thank you very much. With the hormonal imbalance, sometimes it may not go away in just 3 months, in 6 months. It's really a long-term thing which would need continued care. You shouldn't stop at only 3 months. I think you'd need a review to check how you're doing previously, if you're not having the periods, whether you're now having the periods, or be able to adjust your medicine. And most of the medication, most of the problems with hormonal imbalance, since they affect fertility, if you're on a combined pill like she was, you can't be able to conceive. It should be a process by process thing. If maybe they have done hormonal balancing for a certain time, they may need to do maybe some more medication to help your eggs grow, and then you'll be able to succeed in having a child. But I think that person needs a review.
Okay, they need a review. I think along the way you'll be able to share with them a number where if they were to get to you, they can approach you. Now, good morning. Thank you for the show. I have a question for the doctor. I am diagnosed with PCOS. Medically, I believe. I don't know what that means. I have undergone various tests for different hormones and scans. Everything seems to be okay except the LH, which is low. I have failed to conceive and do experience irregular periods. Please, doctor, help me. What can I do to conceive? Currently, I have been placed on metformin and other supplements. I have managed some of the symptoms like the acne, the beard hair, but I have still failed to conceive.
Thank you very much, viewers, and for your questions. For that very person, I think they have tried to manage them since they're on metformin. Metformin helps at least to improve the disease process and makes it a bit mild, and it can help to stimulate the ovulation. But that may not be enough. That person requires further assessment to see where they are, how irregular the periods are. They may need some bit of hormonal balancing. Then we embark on trying to conceive. But there is hope with the polycystic ovarian syndrome. If you know the condition already, it is manageable. It is, we know, most of the fertility clinics really, we know how to handle your condition, and if you reach out, you would be helped.
Okay. Now, viewer, if you're still watching, it's the Health Q&A talk show. And at this particular point, we are joined by Dr. Moses Batwala, who is the medical director of Fiona Fertility. Doctor, good morning. Dr. Moses, good morning. How are you? I hope it's a good morning in Dubai. I might be saying good morning, forgetting that I'm in Uganda here. I don't know what the time zone is like your ends, but thank you for joining us for the show.
Yeah, thank you. Yes, it's we're in Dubai, and at the moment it's okay. Although we do get the occasional scares from alerts about the attacks, but we're actually okay in Dubai.
Oh, okay, that's good. Now, doctor, you've joined in at the time when we are busy engaging with the viewers who are asking a lot of questions here and there and their concerns on as far as hormonal imbalance is concerned. Then there's good morning, doctor. I'm 50 years old. And I stopped menstruating, but I do need to get medication to menstruate again. Is that possible? You might.
No, although that is a hormone imbalance, it is something natural. But when women stop menstruating, and especially at that age of roughly 50, they are most. And when a woman has gone through the menopause, it means there are no more eggs left. Okay? Unfortunately for that, and you can give the women medications, hormone like HRT, hormone replacement therapy, which will give them periods again, but those periods are kind of, they have been artificially induced. And this means, and although you have periods, you can't, you're not releasing eggs because there are no eggs left. And therefore, your options, if you want to have children, is you'd have to consider in that situation donor eggs, unfortunately.
Okay, then we have one who is asking, is swollen face a symptom of hormonal imbalance among pregnant women?
In pregnant women? If a woman is pregnant and she develops a swollen face, there could be lots of other reasons for this. Some of them may be related to hormones, but one thing I'll check with that lady is, does she have a high blood pressure? Because that could be a sign of preeclampsia. So they should make sure that they check that their blood pressure is normal and their urine is clear. But in terms of swollen faces, they can be different conditions which are hormonally induced during pregnancy, such as Cushing syndrome, which is actually something that is an endocrine organ above the kidneys that might cause this. There are also tumors of the brain that can cause this. There are very few things to do with the ovary, especially if you're already pregnant. And also part of normal pregnancies, women put on weight and their faces may become more swollen. They also retain more fluid during pregnancy. So that could be entirely normal in pregnancy and not have any insidious cause.
Okay, now there is this one for you before I get back again to Dr. Judith. Good morning and thank you for the show. Can you get pregnant when you're experiencing hormonal imbalance? Yes,
the answer is yes. It's less now. The most common hormonal imbalance that we see in fertility clinics. I had a previous caller ask about polycystic ovarian syndrome, and this is where women have irregular periods, and most of the time they're not ovulating. And typically, if a woman goes more than 35 days, if her cycle lasts longer than 35 days, then the odds are she's not ovulating. But it doesn't mean she isn't ovulating. It's just that she's less likely to be ovulating. And there are some women who have no periods and then they release an egg, and if they happen to have sex at the right time, it can be the egg can be fertilized as long as the woman's tubes are open and the man's the sperm count is good, and they do become pregnant. But they're less likely to become pregnant compared to women who have regular periods. And when I say regular, cycles that last between 26 to 35 days. Those are and 99% of women whose cycles last between 26 and 35 days naturally are ovulating. And if they're ovulating, they're likely to become pregnant if they have sex at the right time.
Okay. Now, this goes... Yes?
Yeah, I'll say, with the previous lady who spoke about having polycystic ovarian syndrome, they are both expectant or non-medical ways of addressing it, medical and surgical. But in terms of non-medical, with most women who have polycystic ovarian syndrome, PCOS, as that patient mentioned, one of the key things is losing weight. Okay, because most of these patients they have raised BMIs, they are medically overweight, and therefore they stop having periods. But losing weight, where they bring down their BMI, can get them to start having regular periods. And probably that's why the doctor was giving the patient metformin, Metformin is a drug used to treat type 2 diabetes. But one of the things that metformin does is it helps patients lose weight. Now they can lose weight medically with the tablets, but also exercise and dieting, being more cautious with your careful with the amount of calories you take in. And if you exercise more and you lose the weight on your own without any medical intervention, you can start regular periods again and you can become pregnant. If that fails, that's when you can go into medical, where we can treat it with metformin, also with things like Ozempic and Mounjaro, which can help patients lose weight. If they lose weight, their periods become regular and they can conceive. And lastly, surgical, where they're taken into, we do something called ovarian drilling, which can be done keyhole. You don't have to open the patient up, but they then burn like 4 holes in each ovary. It's day surgery. You don't need to stay in hospital overnight. You can be discharged the same day. And women who have that, they also start having regular periods and they can then conceive naturally.
Okay. Now this goes to both you and Dr. here on set. Dr. Judith, kindly help and advise. My wife conceives, but sometimes the pregnancy doesn't exist 2.5 months before she miscarried. Could it be an issue of hormonal imbalance? Who would like to go first? Okay.
Is that your
Okay, you go first, then Dr. Judith will also add to that.
Okay, what he's describing is something called recurrent miscarriage. And there are many causes of recurrent miscarriage. The most common is actually chromosomal or genetic. And so, which accounts for about 80 to 85% of the reasons why women have recurrent miscarriages. And this can be investigated with a blood test to find if either of the parents has a chromosomal or genetic reason that's leading to this. The second most common is a blood clotting problem, which can be corrected with aspirin or Clexane, blood thinners, heparin. But then in less than 5%, you do find hormonal causes. The most commonly associated hormonal cause of miscarriage is hypothyroidism, where the patients have an underactive thyroid. And this can be corrected by giving the patients liver. One, it can be investigated by doing thyroid function tests. And if it's proven to be the case, then it can be treated with levothyroxine, which is a hormone that normally regulates metabolism throughout the body, but this can be given to women prior to them becoming pregnant, and this will reduce the risk of miscarriage. So that is the most common hormonal cause, but by far and large, the most common causes of recurrent miscarriage are genetic and followed by thrombotic, which is blood clotting issues. Those account for the bulk, and then hormonal accounts for a small amount of them.
Okay. Then let me first get to Dr. Judith a bit. Now, hello, doctor. I am 49 and I have irregular periods. I was told I have an ovarian cyst. How can I go about this?
49 years old. Would be interested in knowing if she still has regular periods. Then if she has had assessment of her tubes, if they are open or not. Because at 49 years, on average, the ovarian reserve has reduced. Would be interested in if periods are still on or they have gone. But an ovarian cyst, if it's just one, sometimes it may be harmless. It may not be the cause of the infertility. So that patient would require further assessment to understand why they are not conceiving.
Okay. Then you have one who says, I had a forced abortion in 2024 November, and up to now, I cannot get pregnant from my new husband. What could be the problem? The word forced abortion.
Now,
for medical reasons, I would like to assume.
Now, forced abortion, it may have been done not in a good way, the way she's describing it. Sometimes someone may develop infertility when there is an interference with their womb. Like in some, like evacuating some abortions, if they use certain instruments that remove the products of conception. Sometimes those instruments may go deeper and remove the layer which is responsible for normal menstruation, and instead of monthly shedding off of the uterine lining, someone develops scars in those areas where the baby should come actually and implant. So it's called Asherman syndrome. When they do evacuation and most of the uterine lining is removed. It heals by scarring and it is not suitable for implantation of the fetus.
Okay.
But they can come through, we can find a way to help.
Okay. Then this is Lumumba from Arua. Dr. Moses, this is for you. Lumumba has quite a number of questions, but question number 1. Many women report being misdiagnosed or having their symptoms dismissed. Do you think women's hormonal health concerns are taken seriously enough by healthcare providers? And why might this still be a challenge today? That is question number 1 from Lumumba. He's communicating all the way from Arua.
Okay. Well, I'd say, first of all, thank you for that question. To him, it's really talking about having patients seeing specialist doctors in this to be properly assessed. He may be right that the women have not been investigated fully to find out what the cause is, but also depends on who they have seen, because fertility is its own specialty within obs and gynae. And if they do see they may see an obstetrician and gynecologist, but that could be a generalist, but they should be referred to a doctor who has a special interest in infertility. And normally, if they do see those doctors will be able to investigate them properly and then give them find out what the underlying cause or diagnosis is, and then give them the proper treatment. So if there is someone who feels that maybe they have not been investigated fully, they should ask for an obstetrician and gynecologist who specializes in fertility, and that doctor is most likely properly qualified to investigate, diagnose, and treat the underlying condition.
Okay. Then the same person still has hormonal imbalance symptoms such as fatigue, mood swings, or irregular periods can overlap with many other conditions, which is true. How can women advocate for themselves to ensure they receive accurate testing and diagnosis?
Okay. Well, firstly, it's very important for the doctor to properly explain to the patient what investigations they're doing, what they're hoping to why they're doing them, and what they're hoping to find. And once that happens, once they make a diagnosis, then chart to the patient exactly what the course of treatment is going to be and what success looks like. So if at any of those stages, the doctor hasn't fully explained to the patient what they think the underlying cause is, what investigations they are hoping to do, what results they're hoping to see, and then the treatment afterwards. So those are 4 different stages. If a patient feels at any of those stages they're not getting adequate communication from the doctor, the first thing I would say is that they should consider getting a second opinion, and a second opinion from another doctor who also specializes, and seeing whether they both concur.
Okay. Then you have somebody asking, this is Miriam, what causes extra body hair in menopause? Extra body hair.
Extra body hair. I wouldn't say, okay, there'd be a number of reasons. I wouldn't say that there's extra body hair. You do get elongation of the hair follicles on the patient's body, and this is due to this can be due to the changes, the natural changes that go on in a female's body. Her estrogen drops, and when the estrogen drops, follicles tend to well, I wouldn't say grow. You don't get more follicles, but the follicles tend to grow longer, but this could also be combined with decrease in body fat, sorry, not decrease, increase in body fat. So I would say that there are a number of factors, and also it could also due to how is the lady looking after herself cosmetically. These could be different reasons why there is an appearance of extra body hair. I wouldn't say there's extra, it's just maybe they become more prominent on the body, but they're not extra. The women don't become, do not get more follicles during the menopause.
Mm-hmm. Okay. Okay, then I get to you, Dr. Judith. Sorry,
what I'd also say is they become coarser. Actually, the follicles become coarser. They become, women, because of a high estrogen, their follicles are more fine. But as a woman goes into menopause and she loses, her estrogen levels fall, and they fall similar to the levels seen in men, and their hair tends to become, men have much more coarser hair. Like, I mean, you can see my beard, I have a little more. But because it's becoming coarser, it's becoming thicker, it becomes more visible, and that's probably what people see. It's not getting more, but it's just becoming coarser and thicker.
Okay. Then I get to Dr. Judith. Is it possible for someone to ovulate twice a month, and what are the causes? And also, what causes someone to menstruate twice a month?
Thank you very much, viewers, for the question. Just like Dr. Moses has talked about the menstrual cycle, it is normal. For some sources, they say 26 days to 35, but it can be as short as 21 days as well. 21 days to 35 days is a normal menstrual cycle length. So if someone has a short cycle, like 21 days, they will perceive that they have menstruated twice. So it's better for someone to understand the length of their cycle. It may vary by a day or two, but usually the cycle length is a constant for a person, and it varies from one individual to another. So maybe about the menstrual cycle, usually we have two phases of the menstrual cycle, what we call the follicular phase and then the luteal phase. The follicular phase is under the control of estrogen. Estrogen, meaning in the follicular phase, there is proliferation, the building up of the uterus lining. Then in the luteal phase, it is more under the control of the progesterone, where the glands increase to prepare the womb for implantation. So midway there, it is ovulation. The luteal phase is constant. It is 14 days. The 14 days towards your periods are constant. So for every woman, whether your cycle is 35 days, 21 days, you will always ovulate on the 14th day towards your period, not from when you see the period. When you see the period, it is day one. So if you have a 21-day cycle, you will ovulate at day 7. Then the other 14 days are a constant for all cycles.
Okay. Then Dr. Moses, this is the last question to you. My name is Shamila. I was told I have hormonal imbalance, but I usually experience a foul smell, a bad smell towards the periods from the vagina. What causes that? The foul smell?
It could indeed be a hormonal imbalance. What women have is, in the vagina of a woman, women have good bacteria and bad bacteria. Good bacteria, like in our digestive systems, we have good bacteria which help us digest and absorb food. Actually, if we didn't have those bacteria, we would not be alive. And same thing, in a woman's vagina, she has good bacteria which normally protect the woman from bad bacteria coming in and colonizing. And so some hormonal imbalances can either cause an overgrowth of the good bacteria, where you have too many of good bacteria growing. The most common is a condition called bacterial vaginosis, which is an overgrowth of the good bacteria. Other hormonal imbalances can cause a decrease in the good bacteria and an overgrowth of bad bacteria, and they in turn can also cause cause a foul smell. So what I'd advise is, yes, this lady should have swabs done to find out, does she have a overgrowth of her good bacteria, and know what is the sensitivity and can be treated with antibiotics, or if it's bad bacteria, also treat that with antibiotics, get rid of them. But then also subsequently be investigated to find out why is she having a flux in her normal hormone imbalance to be causing or to what's leading to these overgrowths of either good or bad bacteria, so that is corrected so that doesn't happen again.
Okay, then you have Daisy from Gulu is asking, does family planning also cause hormonal imbalance?
I would say the answer is yes, because most family planning, if women are taking contraception, either the pill or the injections or their coils which release hormones, one of the biggest ways in which family planning can help you not become pregnant is by disrupting the hormonal balance that is normally there, the normal cycle. But that is how most hormonal family planning works. It disrupts that hormonal imbalance. So I wouldn't say it is causing it, but that is the reason why it works. It works to disrupt the normal hormonal cycle.
Now this comes to you, Dr. Judith. Does hormonal... Please go ahead, Dr. Moses.
Sorry. And not to worry you, most of these hormonal imbalances caused by family planning are easily reversible. Once the woman decides, I want to try and have a child again, most of them, once you stop them within 2 or 3 months, the female's body goes back into what its cycle was before she started taking the hormonal contraceptives.
Okay. Then there was someone who's asking, this I'm going to throw now to Dr. Judith. Does hormonal imbalance cause infections and irregular periods and too much abdominal pain?
Repeat the question.
Does hormonal imbalance cause infections, irregular periods, and too much lower abdominal pain?
I will say yes, but not always. Some hormonal imbalances, like let's say for a woman who is in menopause, they may be at risk of vaginal infections because of the reduction in the estrogen. Estrogen is important in a way that it keeps the vaginal walls moist with good pH, which controls it from the bad bacteria. But reduction in the estrogen would put a woman at risk of the abnormal bacteria overgrowth. Then for the irregular periods, yes. For most women who have hormonal imbalance, they will present with irregular periods or no periods at all for certain period. So it's a yes for the irregular periods. Then low abdominal pain, some like in polycystic ovarian syndrome, where the cysts are big, sometimes they have episodes of growing so big and they can be painful because of the stretch they exert on the internal organs. So there may be abdominal pain. It could be occurring at, it may be exaggerated at the time of menses. Some people, if you've taken like 3 months without a period and now someone is bleeding after 3 months, the period is likely to be heavier, more painful, which would be perceived as abdominal pain. Yeah.
Then there's somebody who's asking about, she has spent 1 year without having their periods because they're using family planning methods. Maybe you might need to explain to them about the connection between, how should I say, the family planning, yeah, and its effect on how it will affect the periods. Dr. Moses, over to you.
Okay. It depends on what contraception they were using. The most common hormonal contraception is the combined pill, which women normally take for 21 days in a month, and then they have a 7-day break. And this one, once you stop it, it normally takes 1 or 2 months before women get their normal periods back, cycles back. Same thing with the progesterone-only pill, which is taken continuously. But however, there's also a coil which has a hormone, it's called a Mirena coil, and that one more or less within a month of removing it. However, the injectable contraception, it's called, the most common one I know is called Depo-Provera. It's normally given as an injection every 3 months, and it's a very effective contraception. However, if some women, if they've taken it for more than a year, and that's taking it every 3 months for more than a year, they find that when they stop it, most women will have a period within 3 to 4 months, but there will be some women where it takes a year or even slightly longer for their periods to go back to the pattern they had before this. But this is almost exclusively with the Depo-Provera injection, because it has been injected into the abdomen, and so it can linger in the system for a longer period, which is, but that is the contraception that is associated with it. But with the it's not used as much compared to the pills. But unfortunately, the injectable one, it does have that side effect that it can linger in the system for up to a year.
Okay. Then you have, hello, I am watching from Mbale. Thanks for the program. I'm experiencing a lot of heavy bleeding after having spotting periods for 2 months. Should I continue with contraceptive pills to normalize the bleeding? Dr. Moses?
It depends on what the cause is. There are many reasons for irregular bleeding, and I'd want to know how old the patient is. Most of the irregular bleeding that women have is hormonal, and most of it can be corrected by using a simple intervention such as the contraceptive pill. However, they are less common but most serious causes of irregular bleeding, especially for women over the age of 40, such as cervical cancer, such as cancer of the lining of the womb. So I would say, rather than just going onto the pill, see your doctor first, especially for women over the age of 40. Under the age of 40, these things are less likely, but women over the age of 40 with irregular bleeding, first see your doctor, make sure they investigate. If you're having irregular smears, that's also a good thing, because that is helping you screen for cervical cancer. But also see your doctor if you're over 40, because you could be at risk of cancer of the lining of the womb. That should be investigated, and if everything is normal, then yes, the pill is something that can easily correct your hormonal imbalance and give you much more regular periods after that, if you're not trying to conceive actively.
Okay. Then you have one, my wife got an abortion in December 2024. We were lucky to conceive in July 2025. But unfortunately, after 6 weeks, she got a miscarriage with unknown cause, no sickness or accident. From that time on to date, we've been trying to, but no success. She's 44 years and I am 46. Time is running out for us. What can be done?
Okay. And I'm very sorry when I hear about that. And more than likely, the lady had a miscarriage, which is unfortunately more common in women as they get older, especially over the age of 37, that women do experience more miscarriages. These are not necessarily due to hormonal imbalance. They are most likely due to chromosomal or genetic reasons. For this lady, as she's 44, what I would advise, if resources are there, and when I talk about resources, I'm talking about financial resources, is one, she can opt to have IVF with what we call pre-implantation genetic testing, where they test the embryo to see if it's chromosomally normal, and then they only put the chromosomally normal embryos back into her. The other alternative is to hopefully conceive naturally and see a doctor early. Maybe they can give them progesterone, and then when the patient gets to about 12 weeks, they can do a blood test to see if the embryo is chromosomally normal. There are options. It all depends on what kind of financial resources the couple have, and how willing or they are to either have an intervention such as IVF to screen for the embryos before the embryos are put back in, or the alternative is they get pregnant naturally, And then if they get to 10 weeks, the pregnancy can be screened to make sure that the embryo is chromosomally normal. But my advice for someone who's a woman who's 44 years old, is to have IVF with pre-implantation genetic testing to screen for the embryo. But I know it is expensive, and so this really depends on what kind of financial resources the couple have. Okay,
then I'll get to you, Dr. Judith. Is it okay to get menstruation after 2 to 3 months? And can such a person conceive? This is Karunji Cleo in Fort Portal asking.
Thank you very much. Just from our previous discussion, it's not normal to miss periods. Getting a period after 3 months, after 2 months is not normal. It may signal to her that she has some bit of hormonal imbalance. And hormonal imbalance, if the tubes are open, if the partner's semen analysis is normal, she can conceive with a bit of an intervention. We can help balance the hormones, then maybe do some ovulation induction. It can assist her to conceive.
Okay. Then apart from, this is William from Soroti, and he says Soroti City sub-region. Apart from hormonal imbalance, apart from imbalance of normal vaginal balance, that is the good and the bad bacteria, what other medical or psychological factors are associated with having multiple sexual partners that could contribute to persistent vaginal odor in women? Because you talked about the good and the bacteria, good and bad bacteria. Dr. Moses did talk about that.
With the multiple sexual partners, someone is at risk of sexually transmitted infections, which can also give an abnormal discharge and abnormal bacteria, which are even more dangerous than if someone got certain bacteria with the same partner. If someone has multiple partners, they are at risk of those sexually transmitted infections, and they can potentially even cause infertility. The sexually transmitted infections have been linked to tubal diseases where they block the tubes. Okay. So I think it's good to engage in good sexual practices. If you have multiple sexual partners, someone would use protection to minimize the vaginal infections.
Okay, then over to you, Dr. Moses. This is Rena from Kampala. I gave birth in December, but I resumed my periods after 2 months. Could this be normal or not? She further asks, I'm now in my second periods, but the blood is a bit dark and very little. Could this be a problem to my life? After all this of giving birth, when I try to walk, I bleed even when I'm not in my periods. That sounds worrying. Bleeding when she's not even in her periods. Okay?
Okay. Now, what I understand, she gave birth to, from the question, she gave birth 2 months prior.
Yeah.
First of all, the question, there are a number of things she should be properly assessed, yes, to make sure that and I'd advise her to see her midwife or her doctor. But there also to find out, is she breastfeeding or not? Because breastfeeding can affect, whether you're breastfeeding or not, can affect your hormonal balance. Women who tend to breastfeed may not have periods for a long time because while they're breastfeeding, their ability to conceive is suppressed. So most women who breastfeed may not have any periods at all. If this woman is breastfeeding and is having irregular bleeding, it's important that she goes and gets investigated. She could have an infection. I don't know whether she had a cesarean section to deliver or had a vaginal delivery. Did she have a tear which was not repaired properly? Did she develop an infection from a poorly healed vaginal tear or episiotomy? Could she have a bit of a retained placenta from the delivery? So there are a whole host of different causes, some of which are worrying. And yes, it is important that this lady sees, one, her midwife, and two, her doctor, for them to fully investigate and find out what the reason is. Very rarely would it be a hormonal cause so soon after delivery, especially if she's breastfeeding. If she's breastfeeding, most of the time, she wouldn't have any periods for a long time.
Someone is experiencing lengthy periods, almost 3 months non-stop, spotting heavy flow, regular flow, but doesn't stop. They are overweight and have been diagnosed with PCOS through the scans that were done. They are taking PCOS, but still no change. What can you advise? Then they're also giving a disclaimer. They had a history of no periods at all for 4 months, straight into their early menstrual cycle at the adolescent stage.
For this, I'd first of all want to know, it's important to understand what are the risks of polycystic ovarian syndrome, because it very much sounds like this person has polycystic ovarian syndrome. And most women with, many women with polycystic ovarian syndrome are overweight. And then they tend to have either long irregular cycles where they may have no periods for 2, 3, 4 months. And then when they occasionally have their periods, these periods can be heavy and prolonged. Now, the worrying thing with women who have polycystic ovaries, who have very irregular or few or no periods at all, is they are at risk of having neoplasia, which is a kind of like an early stage cancer of the lining of the womb. And this can be manifested as prolonged bleeding. And this is very, very important for women, especially if they have polycystic ovaries and they don't have a period for over a year. Because normally when you shed away your lining, you're shedding away the lining, and that is protective against developing cancer of the lining of the womb. We call it endometrial cancer. So if this person is having, after a period of, a long period of not having periods, all of a sudden is having long continuous bleeding, I would say it's important that they see their gynecologist, their family doctor, who can investigate them. They can do a simple biopsy of the lining of the womb to check if they do have any kind of malignancy of the lining of the womb.
Now then, this I'm going to throw right to you, Dr. Judith. Good morning, doctor. Following you live from Arua. We have 2 kids, but my wife has told me she's never seen periods in her entire life. But she always finds herself pregnant. Is that one possible? That's weird.
In that particular patient, I would really want to know whether they have never seen the periods right from puberty, they have never experienced puberty, because it would be really impossible for someone to conceive without having any menstrual period in their life. It would really be difficult. But sometimes, in some cases, it may happen that maybe you've missed a period and then you find yourself pregnant. Take an example, like if you've just given birth, you've not had a period for like 6 months, you can conceive even when you've not yet seen a period. I think that is more practical. But in her situation, I feel it's not so practical. Because in pregnancy, when the hormone for breastfeeding goes high, it will suppress the menstrual period. And then you can easily conceive that, meaning you were supposed to have a period, but you got pregnant in that very cycle. That's how you can conceive.
Okay, then this one is, thanks for the show. How long can I take, is it called Hormonal capsules, to balance the hormones? Because the doctor recommended, there's another one I can't pronounce, or Hormonal. And then thanks for the show. This person is from Chiwatule. How long can they take this medication or capsules to balance their hormones and conceive?
Just like we had earlier talked about supplements, Hormonal is a supplement. It will help a bit to stabilize the hormones, but not fully. This person may need more treatment to deal with PCOS than only taking the Hormonal, because it's just a supplement. But balancing the hormones, you may need real hormonal supplements together with the Hormonal as an extra thing to take. But just like we've seen for polycystic ovarian syndrome, these women don't ovulate every month. Even when the periods come, sometimes they may not ovulate. So they would benefit from ovulation induction drugs, which Hormonal doesn't do.
Okay. Now this one is specifically for you. The lady doctor is has a friendly voice and reassuring attitude. They say I keep bringing you on the show. This is Vento from Chisasi. I don't know if you know her, but that is what they say. Dr. Moses, I am Anita from Kamwenge. What causes having miscarriage all the time I get pregnant? Always miscarriage at 2 months. Her miscarriages occur at the stage of 2 months.
Okay, and again, it's that question is very similar to the patient who, the other person who mentioned having 2 or 3 miscarriages. We call this recurrent miscarriage. And the most common cause of this is actually genetic rather than hormonal. It can be investigated with a blood test on both the male partner and the female partner to see if either of them carries a hormonal imbalance. The next most common cause of this is a clotting disorder, whereby the woman has a tendency to clot much more easier than other women. And some of them may have a family history that they have had a family member have a deep vein thrombosis, which is blood clots in the back of the calf, or blood clots in the lungs, especially if they were taking the contraceptive pill. These are the 2 most common causes. They are and they can be investigated with blood tests, and they can be treated with the genetic. You can do something called pre-implantation genetic testing of the embryos before you put them back in, although that is expensive. But we need to understand what the underlying cause is. It causes recurrent miscarriage in about 80% of couples that we see, whereas 15% is caused by clotting disorders, and that can be treated easily and cheaply with aspirin and heparin aspirin tablets and heparin injections. Mm-hmm. The less common but still present causes of recurrent miscarriage, which is less than 5%. The most common is something called hypothyroidism, where you have an underactive thyroid gland, and again, this can be investigated with a blood test, and or some patients even you can see that they have a goiter, which is an enlarged thyroid gland on their neck. This can be treated by giving them tablets, thyroxine tablets, and this can correct and prevent miscarriages happening again. There are other causes, but it's always important that you see a doctor who can investigate you properly. There are some women who may have fibroids, are very common in African women, and sometimes you have something called a submucosal fibroid, which is a fibroid that grows into the cavity of the womb. This can cause problems of implantation to the baby. And if this is the cause, it can be treated surgically to remove the fibroid that is causing this. So there is a variety of reasons, but it's important that the patient is investigated fully to understand what the underlying cause is, and then that can be treated.
Okay. Then this is for you from Harriet from Lira. I just want to know what causes clotting of blood during menstruations, because every month I experience too much pain and then there are clots visible in her blood. That's what she says.
Okay. Yeah, so if she's having heavy, if women have heavy periods, there's a lot of blood, and if there's a lot of blood, that tends to clot, and people become more aware of it because of the volume. There are a variety of reasons. One of them is hormonal. There can be a hormonal imbalance, and if these women are not trying to get pregnant, the easiest and cheapest way to treat this is to go onto the contraceptive pill, or different types of hormonal things to address this and decrease the volume of bleeding. It can also be treated with things like non-steroidal tablets like ibuprofen, tranexamic acid, or mefenamic acid. These, one, they decrease the pain due to the heavy periods and also decrease the volume, and you find that with decreasing of the volume, you don't have the clots. But also because in one of the other things that's very common, especially in African patients, African women, is fibroids. And sometimes if women have large fibroids, especially those, we call them submucosal fibroids, which encroach into the cavity of the womb, these can cause heavy periods, and in turn, when you bleed heavily, that blood tends to clot, and you see the clots more visibly, which can be sometimes upsetting to some women, and even lead to anemia. So again, what I'd advise is, because of their different causes, have some investigations done, like a pelvic ultrasound scan. It will show if you have fibroids. It will have blood tests done, which can see. You can also look at the ovaries, see if you have any cysts that could be causing this, or things like endometriosis. These can all be investigated, and they can be easily treated. But the important thing is to understand what the underlying cause is, and there are very many options to treat this.
Okay. Then, Doctor, this is Alan from Liantonde. Can family planning cause permanent infertility?
I would say the answer is most family planning does not cause permanent infertility unless people opt for the type of family planning which is permanent. And when I say permanent, there are two types. One, for women, they can have, some women choose to have clips or have their tubes tied off, or put clips on their tube, which will make them permanently infertile when they try to conceive naturally. So that is it's called tubal ligation, where you either cut or tie off the fallopian tubes, and this is considered a permanent form of contraception. The other form is for men, vasectomy, where they cut off the tubes that bring sperm from the testicles to the penis. And if it's done after 3 months, if you haven't produced any sperm, this is considered permanent as well. There are ways through IVF of getting around this, but for all intents and purposes, these are considered permanent ways of contraception. The other forms of contraception, such as taking the contraceptive, one barrier with like condoms, or the female condom, or using the contraceptive pill, the progesterone-only pill, the implant, which is put underneath the skin, or the Depo-Provera injections. These are designed not to be permanent and to be actually quite reversible within a short while of you stopping them and wanting to have children again. So the question is, can family planning cause permanent infertility? It really depends on the type. There are two of them which are designed to be permanent, and that is tubal ligation or the vasectomy for men. But the other ones tend to be totally reversible.
Okay. Now, Dr. Moses, I can quite see many people are asking for your number. Others are asking you should come back again because they feel like they have a lot of issues they'd like you to have discussed and exhausted with them. So I believe you can spare us some time next week, and you can still come back to address the concerns of the viewers, because a lot of questions are still flowing in. But they're asking for your number. They would like to get in touch with you and feel like have their issues addressed. They're also asking for Dr. Judith's number, by the way. You are the one who said you should come back again. I should bring you regularly. Okay, now, I'll first get to you, Dr. Moses. I'd like you to share your parting shots with the person who's watching right now. What would be your final message to the women out there, because this is our month as far as hormonal imbalance is concerned?
Yes, I'd say hormonal imbalance affects very many women. In fact, almost my entire specialty of infertility, it's about treating women's hormone imbalance to help them conceive naturally. If there's a parting shot I can have, is seek specialist care. Try and seek out, if you're trying to conceive and are having difficulty conceiving, if you have irregular periods especially, because the easiest way that hormonal imbalance exhibits itself is by women having irregular periods. There are other symptoms, but if you're experiencing any of these things, seek specialist advice. Ask to see your obstetrician and gynecologist, and ask them to refer you to a fertility specialist who will be able to investigate and treat you appropriately. We at Fiona Clinic, and we're happy to share our number. People call us from all over the country, Arua, Mbarara, Mbale. We're based in Kampala. We do occasionally do fertility camps, but if you want to get in touch with us, we will share our phone number shortly after this. And we do WhatsApp calls, WhatsApp video calls. We're happy to take to advise you to have investigations close to your homes, and you can share these with us. And then we're happy to try and treat you remotely, whichever town you are across the city. But if across the country, but if it requires specialist care, we're more than happy to see you at our clinic in Intinda in Kampala.
Okay. Thank you so much, Dr. Moses. It was lovely hosting you. I believe we shall still have you again here next week. Your parting shots before we get to the committee, please.
Thank you very much, viewers, for the wonderful audience. Your questions have made me realize that you were listening actively. And what I can add from what Dr. Moses has said, be keen about your body, know all the symptoms that we've talked about, be mindful, don't self-medicate. Whenever there is a problem, approach the specialists. The different fertility clinics, really, we are there to help you in most of these hormonal challenges. Most of them are really treatable compared to the other fertility challenges. They are really manageable. And we are more than happy to talk to you, listen to your issues on our number, which I'm going to share with you, 077 046 2432. You can call or WhatsApp us on that number and be blessed.
Okay,
thank you very much.
Thank you so much, Dr. Moses, and thank you so much, Dr. Judith, because I know it's been such a lovely time for you to be able to share with us. I don't think I need to add more because they've said it all. At this particular point, I'd like to hand you over to Park Central as the officials of Ministry of Finance appear before the committee. Thank you so much. We'll catch you next week, same time.
The truth. Relatedly, the PS was saying they plan to clear these areas in the mid-term. And he said the term, mid-term is known. For avoidance of doubt, Chair, according to the law, mid-term is between 3 to 5 years. So I wanted him to contextualize the 200 billion in the mid-term and juxtapose it with the outstanding balances on arrears. And see whether even by applying the mid-term definition, whether the balances can actually realistically be cleared in the mid-term, as he says.
Chair, may I?
On arrears still?
Yes. I have computed it is 48 years.
Because, so,
yes,
that
yes.
is... So,
Chair, for the 9.6 trillion, at 200 billion per year is 48 years. The mid-term has a maximum of 5 years. But also remember, in the time, annually, there is a rate of growth of those the domestic areas. So we are not taking into consideration the new domestic areas that arise. So this figure will be growing. The domestic areas will be growing, it will not be static. But the current one, at the rate at which we have programmed to pay,